Hi, Nick Brook here from EastWestUrology. This video talks you through the steps to give a Caverject intracavernosal injection for erectile dysfunction. It does go through this in a step-by-step way, but this does not replace a medical consultation in any way, and I would strongly advise you to talk to your urologist about this, as it's straightforward once you've got the hang of it, but it can be a little bit complicated until then. What I do with most of my patients is talk them through an injection in clinic that they do themselves, and once they feel confident doing that, then they can do it on their own. So stay tuned and we'll take you through this step by step. So the first step is to take the packet out and open it up, and there are three contents within each packet. There's the syringe itself, there's a needle, and there are two sterile wipes. The first step is to connect the needle to the end of the syringe, and this is done by peeling off the tab from the bottom. Just be careful because it's very sharp underneath, and there's a needle in here that will puncture the rubber on the syringe itself. To do this, you push the syringe into the needle, click and turn until it can't turn anymore, and then it's locked in place. The next step is to mix the contents, and this is simply done just by twisting the white bezel as far as you can, and you can see here that there's some liquid and there's some solid contents, so you need to keep twisting as far as you can, and this causes mixing of the contents. So you'll see here, twist as far as you can. These contents now need to mix completely and to go completely clear, and you can see here that there's still some solid component in the glass syringe, so keep mixing. You can do this, don't shake, but just gently mix, and eventually this will go clear. The next step is to get all the air out of the syringe, and if you hold this up vertically, I'm not doing this here, but if you hold this up vertically and just squeeze very gently on the white bezel, all of the air will be expelled, so there's just liquid in the end of the syringe. So the next step is to select your dose. This is 2.5, this is 5, 7.5 and 10, and you just do this simply by turning the bezel around. If you go past your selected dose, you can just keep going, so just select your dose as prescribed by your doctor. The next stage is to prepare the penis, and you use one of the sterile wipes to do this. The hatched zone here is the suggested area for injection, so just give a good wipe. Next, you just need to carefully remove the pink cover from the actual needle itself. Be careful, this is very sharp. The next video demonstrates the angle of injection, and you can come in at 45 degrees in this hatched area, and you go right to the depth of the syringe and inject until you can press no more, and then that will have delivered the exact dose that you need. Just take the syringe and needle out quickly and apply the other sterile wipe just for a period of time and press. This just shows that the angle that you can come in at, and it's safe to go to the full depth. You can come in at 45 degrees. I suggest sometimes patients come in at 90 degrees, but you want to come into the corpora cavernosa, which is this hatched area. Inside the packet there is a step-by-step written guide that you can follow as well, and there's also some important notes on adverse events, so please do have a read through those before you use this injection. So that's it, injection done. If there are any problems, anything that we can help with at all, please don't hesitate to get in touch with us, and the number will follow.